I'm Saket. I'm the Associate Medical Director for Alcohol and Drug Recovery Services in Glasgow. I did have a 20-minute slot earlier on. I'm going to do what I can over about 10 minutes, I think, because I need to be a bit of a diva and leave immediately after this. But if you do have questions, then my colleague, Lynn MacDonald, who's put her hand up there at the back, Lynn's here for the whole day. Lynn is a service manager for the new Safer Drug Consumption Facility, and Lynn will be happy to speak to you if you have questions, and particularly about getting support from you in the pre-implementation engagement plan that we have. And so before I begin, I just want to acknowledge the work of other people in this. I couldn't possibly list everybody involved in this project, so just so you know, I'm presenting the work of a huge number of ADP, HSCP, Glasgow City Council and Health Board colleagues, as well as national colleagues, and the SDF have been very supportive. So we're really grateful for everybody's support. This is what I was going to do, tell you about the background, tell you about why drug consumption facilities are still relevant in Glasgow today, talk to you about a legal framework, and then go to the Glasgow drug consumption facility model. But actually, I'm just going to skip quite quickly to that. So hold on to your hats. Here we go. The background to this is related to HIV, and you can have a look at the slides and have a look at this later. But as you know, there was an HIV outbreak in 2015. We did a public health needs assessment of people who inject drugs in public places that recommended heroin-assisted treatment and a drug consumption facility. We were able to implement the heroin-assisted treatment, but not the drug consumption facility for legal issues, as in we didn't have the legal requirements, legal permissions in order to progress that. But the problems related to people injecting away from home have actually continued, if anything, to get worse since 2015-16, when we first promoted a drug consumption facility in Glasgow, and drug-related harms, as seen by this graph of drug-related deaths in Glasgow City, has been a public health emergency, continuing and worsening in Glasgow City, hopefully beginning to level off in the last few years, but still at a rate that's far too high and unacceptable. And so we had worked behind the scenes with Scottish Government, with Crown Office, with Police Scotland, to see what we could do to implement a drug consumption facility within existing legislation, as legislation change required to implement one wasn't forthcoming. And we were delighted when the Lord Advocate made a statement that she would be willing to look at a new service model. And even more delighted that in September 23, she made the announcement in writing to us and on the Crown Office website that she would be prepared to issue a statement of prosecution policy to allow us to progress with an implementation of a drug consumption facility. So just so you understand the legal framework for this a bit more, and this is particularly important for those in other parts of Scotland or the UK who are considering a drug consumption facility. So the statement of prosecution policy that the Lord Advocate was offering us related only to people who use drugs, bringing the illicit drugs into the environment of a sanctioned drug consumption facility in order to use there. It didn't extend to the staff and the corporate bodies behind drug consumption facilities. And so we've had to get our own legal advice and build in our own legal protections, mainly through standard operating procedures, etc., that protect our staff in the delivery of this service. But the Lord Advocate made it clear in writing to us that her offer of her statement of prosecution policy was really linked to the fact that we were implementing a service in a site that was close to public injecting sites already. It was co-located with a range of other services, that we engaged on community engagement around such a service, and that we entered into an independent and robust evaluation of such a service. So we've been busy working away on all these parameters, and actually we've done the most sort of comprehensive engagement exercise that Glasgow HSCP has ever done in relation to any new service at all. And we've made significant progress with academic colleagues with regards to having a very robust and, to be honest, a world-class evaluation of a service, which will be really useful for other partners and services across the United Kingdom. You guys know all about this, so these are the ones that I'm going to skip. I would, if you haven't seen this video, it's a fantastic 20-minute video by Correlation on drug consumption rooms around the world. It's available on YouTube. It really explains the rationale, the different models, the different outcomes different cities and populations have experienced. So really worth 20 minutes of your time. And if I had more time, I would just play that video and then say we're setting up something similar in Glasgow. So our service is going to be located in Hunter Street Health and Care Centre, which isn't very far from here. It's just on the east side of Glasgow city centre. And I just want to make the very important point that actually we haven't been waiting for a drug consumption facility as our only strategic response to the drug-related harms that the cities experience. There's a huge amount of work going on in relation to harm reduction services that have already been rolled out in the city and that are very, very, very active. So, for example, our crisis outreach service has seen almost 2,000 referrals in the last year. We've distributed more than 2,000 naloxone kits in 2023. And I think the point is that without those services, the sad fact of the matter is our drug-related death statistics would be even worse than what they are at the moment. But we are wanting to implement 2 new services in Hunter Street, and they are the Safer Drug Consumption Facility and a drug checking service. The drug checking service, as you heard from Alison Byrne from Scottish Government, we've got a licence application in to the Home Office, which we're awaiting the outcome of. So our drug consumption facility in Glasgow will be based at Hunter Street. It'll operate 9 a.m. to 9 p.m. initially, 365 days a year. It'll be managed by the Alcohol and Drugs Partnership and the Alcohol and Drug Recovery Services. So it'll be one of the few, if not the only one I can think of, that's run by statutory services rather than third sector. It'll be co-located with a whole range of other relevant services, and people will be able to use this service without giving us their full name. They'll be able to use the drug injecting area, but if they want other services such as coming into drug treatment services, meeting a GP, getting bloodborne virus testing and treatment, then we will confidentially ask them for their details in that case. What we haven't been able to do is the initial proposals had inhalation rooms in them. Unfortunately, a combination of the smoking legislation complexity in Scotland, the space required for an inhalation room, and the costs associated with them have meant that this project would have been held up even further. And I know how frustrated some of you and I have been by the length of delay in implementing this, but it would have been held up even further if we had tried to put all that together into this proposal. But we do hope that moving forward that we can build on what we have. And I've told you about the drug checking service. This is the staff. Just to say that that's the staffing model for the people employed by the drug consumption facility, but we'll have a range of co-located and visiting services coming in there. The EDTS is the Enhanced Drug Treatment Service, where we do diamorphine or heroin-assisted treatment. got the complex needs services. We're going to commission a GP service to come in. The bloodborne virus and sexual reproductive health teams are there already. And interestingly, I think we were talking about this at the lunch break, we're going to pilot some sessions of acute physicians, doctors who work in hospitals, actually working in this setting to try and prevent hospital admissions or to try and meet the needs of people who really don't want to go to hospital but have acute health needs. So we'll see what the outcome of that is. So the design of the building is, of course, restricted by the footprint of the build pre-existing Hunter Street. But beyond that, we've done a lot of work by engaging with people with lived and living experience, including, as I was saying earlier to our colleagues, women who have an experience of using services as well. And so the build design, look and feel of this is very much informed by that experience, psychologically and trauma informed, and is very different to a lot of other treatment care services that we have in the city. It's also probably a higher spec and hopefully a nicer environment. So I'm going to show you a set of images. And I think what we want to get across to people is that this is not a stigmatizing environment inside, hopefully, that you feel valued, that we are willing to invest in an environment, a physical built environment that is for you, and this is your space. So what I was showing you earlier was this is the reception area. People will come in, they'll need to register. We'll be using NEO for those of you who are familiar with that, or we'll be using NEO for registration. But as I said, if you want to access any formal treatment care, we'll need to register you onto the treatment care systems. We'll ask you about what drugs you're using, planning to use. We'll do some harm reduction interventions and advice, and then you can go into the injecting area. The time spent here when we get to know you might be very little, but the first visit will take just a bit of time. And that's why we want to pre-register people as much as possible in advance of opening. And I hope that partner services here will support us in that pre-registration process. So this is what the Enhanced Drug Treatment Service injecting booths are like. So I'm showing this for two reasons. One is to say that we actually have quite a lot of experience now in Glasgow City of observing people injecting, of responding to people injecting, etc. But you can see this is a very sort of cold and clinical environment, and it's not the sort of environment that our feedback was telling us that people wanted. So the new injecting booths in this facility will be quite different. And they're very much sort of based on a combination of what people have told us and what we can realistically procure and order and deliver. So this will be the injecting area, 8 injecting booths. And then this is what we're initially calling the aftercare, but I think, are we calling it the lounge now? So we started calling this the aftercare, but so consultation rooms have now changed to chat rooms. The recovery area has been changed to chill out area, and the aftercare area is the lounge based on the feedback we're getting from people who are likely to use this. So in the lounge area, we're going to encourage people to stay for as long or as short as they like. In this area, there'll be tea, coffee, and a bit of light food available, and we'll hopefully be able to engage people in whatever level of conversation they're able to and want to engage in. There's going to be a couple of chat rooms off this where we'll be able to take people into confidential discussions if they say, can I speak to a housing officer, can I speak to a welfare rights officer, can I see the GP today actually? Could we talk about my drug treatment? So we're hoping that this is where we'll have those conversations. We're not going to force it on people. It's about when they're ready to have those conversations with us. Yeah, some more images around that. And this is what the lounge area looks like. And there is, following consultation, a smoking area just outside the lounge area. So this is within the confines of the drug consumption facility. So people will be able to leave the lounge area for a smoke after they've used whatever they've brought with them. And then they come back to the lounge area, importantly. After that, you'll see there's high fencing, etc., around it, because we need to manage that there isn't any sharing or supply of drugs in the facility. Yeah, so this is the footprint. So a couple of big things to say. So there isn't an inhalation room, unfortunately, at the moment. And you'll see from that, the injecting area is quite open. And unfortunately, at this moment in time, we don't have sort of a specific closed-off women's space, but maybe in the future, again, that's something we can do and think about time for women as well. We're going to learn a lot in the first 3-6 months of this, and it's an iterative process. We'll keep learning, developing the service in response to needs. So we've done a lot of engagement work, which I won't tell you too much about, except please go to our website and have a look, and we'll update the web pages as well. The things you really want to know. So following consultation, we're actually changing from the title of this service from a safer drug consumption facility to the Thistle. So I think this is the first audience that I've actually got to say that to outside the Health and Social Care Service. So that's again based on feedback from our reference groups and panels. So it'll be called the Thistle, and it'll be based at Hunter Street Health and Care Centre. And there was one other thing that I want. Oh yeah. So opening day is the obvious question that you're all going to ask me, right? So we hope the building is completed by the end of September without any further delays, and then we need to do the final fits inside it. We want to give people, there'll be a lot of interest, so we want to give people access to the inside of the building as much as possible before it's operational. As soon as it becomes operational, we really don't want to disturb people who are using the service with loads of visits, etc. So that'll take a few weeks. Now, Councillor Casey, who's the lead convener on alcohol and drugs and homelessness in the city, announced to the press last week a date of 21st of October. The Health and Social Care Partnership haven't got a date in mind at the moment because we are still waiting for confirmation of some property updates. But roughly speaking, we're working to a timeline around mid to late October, and hopefully we'll be active by then. So as I said, unfortunately, I'm going to jump off the stage, get my bag, disappear out of the room, and please do come and speak to Lynn or get in touch with us through the ADP with any questions, queries. The web page has the ability for you to email us and send us questions and queries directly. We've had hundreds, and we keep an eye on that, and we respond as much as we can. Thank you for your interest. I want to give a big, big thank you for everybody who's been involved in the engagement, has given us advice and support over the last year since we've really got into the implementation phase of a very, very long-awaited project. Thank you very much.